Hi everybody and welcome back. So in this video we're just going to demonstrate or show just in this space here what a HVT or HVLA actually is. So there's a lot of questions around HVTs, are they safe, are they unsafe? I say to my patients coming in, it's the equivalent if a very well trained professional or a relevantly trained professional is performing a HVT, it's the same thing as a person that's relevantly trained driving a car on the right side of the road or the correct side of the road. For us is the left. So for example, what we have are things called restrictive barriers or anatomical thresholds and physiological barriers. So a description that we use within osteopathy is that our adjustment would be a high velocity, low amplitude thrust on a restrictive barrier within the anatomical barrier. So it's not bypassing the anatomical barrier. So what we can see is a range from here to here. And this would be, for example, within a joint, this would be the anatomical start to end range. Generally, what we do with a HVLA or a HVT is somewhere within this range, from here to here, we would generally find that, let's just say here on mobilization, we find some physiological restriction within this anatomical true range. Our job is to then free that physiological barrier within that anatomical range. That's why you will find an osteopath generally accumulating a barrier within the anatomical range. They'll find that restriction, they compress it to find it, and then that little tap goes through, and usually you hear the cavitation, which we have described in an alternate video, which is generally just a fluid pressure gas exchanged once we've collected the barrier and HVT'd through and thrusted through that barrier. So we hope this helps and just clears up a couple of small little things in relation to HVT and what we're actually doing. So what we're doing again, just to recap, is to release a restricted joint. A HVT or HVLA is a technique. It is not osteopathy in total. It's a technique that's used to mobilize a joint quickly. So I hope that helps, guys. Thanks for watching.